having things outlined for the patient and for their family, caregivers, and the physician to provide the best care that they can during this time, I think is crucial.
We don't know what the future may hold and, what is or is not in store for all of us. And it's an area where we can plan just a little bit to address that what if. And doing so can really be a very loving thing to do.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. Today is the third episode in our new revenue recovery series. The goal for this series is to empower you, physicians, administrators, and revenue cycle managers to effectively communicate and ensure your organization does not leave any money on the table. In this episode, we will discuss the importance of advanced care planning and common challenges to capturing these services. Then, as always, we'll explore some practical tips and solutions that you can take back to your organization. We will be discussing detailed coding guidelines, so we've added a cheat sheet to the episode notes, hoping to make your lives just a little bit easier. So don't feel like you have to write everything down. You'll find a lot of information in those sheets. I am excited to once again introduce today's guest. Both are familiar voices for HeartTalk listeners and really experts in their field. We have Nicole Knight, Executive Vice President of Revenue Cycle Solutions and Care Transformation here at MedAxiom, and Linda Gates-Striby, MedAxiom Consultant, Revenue Cycle Solutions. So welcome back to the podcast, both Nicole and Linda.
Hi, Melanie. Great to be here.
Hi, Melanie. Thank you. It's good to be back.
Well, we will learn more about your backgrounds throughout this episode, but please check out their full bios in the episode notes as well. Also, if you haven't listened to the first episode of this revenue recovery series, please go back and listen to the discussion on smoking and tobacco cessation. There, Nicole and Linda respond to the first question that we ask all HeartTalk guests: why they got into the business, why they got into healthcare. So if you want to hear that, please go back and also review that conversation. It was a good one. Linda, to set the stage, what exactly is advanced care planning, and which CPT codes are we referring to when we say this?
Yeah, in a nutshell, we're talking about that discussion between a clinician and a patient on advanced directives. And really, it's adults at any age or stage of health. However, we kind of tend to think of this more in the content of older or sicker patients. But really, it's just to ask or prompt the patient to just give some thoughts. What are their personal values and goals and the things that matter most to them, and really their preferences regarding future medical care. Having that knowledge and that discussion between the clinician and their patient and their family, it kind of guides decisions in formulating current care plans, or it's an iterative process. And it may change with time or circumstances, but giving some thought to this topic and having meaningful conversations with family or other potential decision makers, it's just an important part of an advanced care plan. If you were to become unable to communicate your own decision in some sort of emergent, in the moment situation, it's really helpful and sort of a gift you can give to loved ones to express your wishes ahead of time, and then maybe making that decision a little easier, as they're not going to have to guess. The codes that represents the fact that conversation's been had is 99497. That's for advanced care planning. That includes that explanation, any discussion of those advanced directives. And it is a time-based code. It's for up to 30 minutes with that patient. And it is one that's billable when you exceed the halfway point. So a minimum of 16 minutes spent. If you do exceed the 30 minutes and go above with an additional time, there is an additional code of 99498.
I think, to your point, it is so important to families to have these conversations. And sometimes if the physician can have it versus it having to happen at home, it does make it so much easier. So Nicole, what is the average work RVU and CMS reimbursement payment for these codes?
So for that first 30 minutes, the work RVU is 1.5, and that average reimbursement is around $83. For the additional 30 minutes, it's 1.4 work RVUs and an average reimbursement of $75.
Okay. So Linda, you kind of went through some of the requirements for capturing these services. Anything else you want to point out that must happen in order for these codes to be valid?
Yeah. And as we mentioned, it's a time-based code. So anytime you're documenting and billing for a code that's based on time, you do need to document your time. So the minimum of greater than 50% or 16 minutes, you document that time. The fact that this is a face-to-face discussion with the patient, which is also eligible for virtual. So it doesn't have to be, physically face-to-face in the clinic. It can be done virtually as long as they can see that patient. This is something that's distinct from a general visit. So maybe we're there today to address that patient's heart failure, but maybe we're reaching a pretty difficult decision point in how aggressive we're going to be. So now that conversation expands to say, have you had these additional conversations? Have you given some thought to that? So this could be billed in addition to. You want to note who is present, that the patient's there, that they're competent and alert, and they're voluntarily communicating in this conversation, and then just document the nature of that conversation. There are times that the patient may initiate it by bringing in forms. Maybe they are actively working on their advanced directives, and maybe they have questions for the clinician. If that's completed in conjunction with this visit, that's inclusive. So that wouldn't be something that would be billed separately.
Mm-hmm.
However, just having that conversation and kind of guiding their thoughts and presenting maybe some of their options, it does not require the completion of those forms. But if they are completed, that is included.
And that's where you could maybe get into the additional time that you're talking about. Nicole, what should listeners know about coverage eligibility for the advanced care planning codes?
Yes, as Linda mentioned, much of this is published by CMS in their MedLearn Matters articles, and they do have a complete one on advanced care planning. So that reference is great, and it mentions just what Linda said about the forms, that they're not necessarily required, but if you complete them, it can be included. The other thing is there's no frequency limits, and it's not limited to a particular place of service. So most folks think that you're having these discussions when they're in their office or their clinic, but you're also could be having these discussions in the hospital setting. So no limit on those places of services. And then if you do perform annual wellness visits, it's important to remember that this can be performed and billed for in addition to that with a modifier 33. And the patient's copay and deductible is also waived at the time of that wellness visit. So those are some of the coverage guidelines. And again, that MLN Matters, it does help clarify many of those points as well.
Good resource. Thank you so much, Nicole. So this is an excellent place to pause for a quick message for our Heart Talk listeners. You hear the term care transformation a lot, but what does it mean exactly? Care transformation is redefining the way consumers buy and use healthcare by developing new products, treatments, and business models that integrate separate healthcare organizations or activities. MedAxiom understands that moving the needle in CV care is not simple. It takes vision and leadership, and it requires bridging technology, innovation, and care delivery. MedAxiom experts are helping programs across the country shape the future of cardiovascular care delivery. Through education, organizational performance solutions, and advocacy, we are evolving disease management, innovating virtual care, driving the data revolution, and redefining access and team-based care. Let's transform cardiovascular care together. Get started at medaxiom.com/care transformation. Welcome back. We have been discussing revenue recovery with industry experts Nicole Knight and Linda Gates, specifically how to appropriately capture advanced care planning services. So let's dive a little deeper. We talked about how this can be so helpful to the patient and also other family members. So Nicole, let me ask you, why is capturing advanced care planning, otherwise the explanation and discussion of advanced directives, such as standard forms like we talked about earlier, sometimes challenging for the care team?
Sometimes capturing advanced care planning is challenging for the care team because it's a time-based code. When we have a time-based code, we do have to document the time of the activities that are being performed by the advanced practitioner or a physician provider. And this also has to include the documentation for what you did within that time frame. So how do you create some of the tools to be able to capture that and truly reflect the requirements of the code to meet the documentation of the time, that face-to-face service, if any of the activities included conversations with caregivers or family members?
Yeah, as we recognize, our listeners may or may not be the people, literally doing the coding. But again, the overall success is beneficial for everyone. So what are those top implementation tips, Linda?
Yeah, one of the things, Nicole made reference to various resources and tools. And I know a lot of us, most of us at this point, work with electronic medical records and probably have someone who works in conjunction with the clinicians in the development of shortcuts, 10 minutes of forethought in the development of a template or a text macro or a dot phrase, whatever you call it, something you can easily call up, something, your ACP tool. And then it just prompts the clinician for what are those pieces that need to be documented, a fill in the blank on minutes, who else was present, the patient participated voluntarily, the nature of the discussion. That can easily be done so that all clinicians can document consistently, and that the services are documented and include the required elements. And I've also found that, these are conversations that the clinicians may have that they're not necessarily thinking of it in the context of advanced care planning.
Mm-hmm.
At a primary care annual visit, yes, that's probably something they're going to specifically address. But along the way, conditions present themselves that lead our clinicians to really kind of talk to the patient and say, okay, does this have an impact on what we're going to do going forward? Do you feel differently? Do you think about, is this new news, this new condition, this significant change? How does that impact any of the discussions we've had previously? So just really kind of raising awareness that type of conversation, when documented appropriately, is a separately billable service, and raising awareness of that.
Mm-hmm. Takes a little forethought and kind of planning in order to implement this properly. And Nicole, I want to focus back on the patient. I know we talked about that in the very beginning, but I think it's a great place to end. Appropriately capturing these services ultimately benefits the patient. It makes the lives easier for the family members. It's a good idea if that opportunity does present itself.
Yes, absolutely. And I think, as Linda and I've talked, and as we look at ourselves and as we age as well, I think none of us really want to have these conversations and really think about it. And having these conversations early in the process and having things outlined for the patient and for their family, caregivers, and the physician to provide the best care that they can during this time, I think is crucial. So it is something we all have to think about, and ultimately it benefits the patient because it's having that sorted out before you actually need it.
Yeah, I totally agree. I have a mom who's 81 years old, and it's hard to have these discussions. So it is much easier if I can kind of punctuate what the doctor is saying or the physician is saying. It makes my life a whole lot easier. So to both of you all, Nicole, Linda, is there anything else you want to add to our conversation today?
Yeah, I think it's just important, as we've all acknowledged, we don't know what the future may hold, and what is or is not in store for all of us. And it's an area where we can plan just a little bit to address that what if. And doing so can really be a very loving thing to do.
Mm-hmm. Yeah, I think that's a really good way of looking at it, a loving thing to do for everyone involved. Well, Nicole and Linda, beautiful. Thank you so much for sharing your time and your expertise with us today on MedAxiom Heart Talk.
Thanks so much.
Thank you.
That's it for this episode. If you liked it, please tell your colleagues and let them know they can subscribe to MedAxiom Heart Talk on Apple, Google, or wherever they get their podcast. If you would like to send us a note or suggest a topic, as always, email us at hearttalk@medaxiom.com. Thank you so much for listening.